Hello everyone, we are going to do appendicular skeleton today. So today we are going to go over the upper limb. Upper limb means your arms. So we are going to do the bones of the upper arm. Let me take you to your lab handout. So in the lab handout, you can see right here pectoral girdle and upper limb. Pectoral girdle and upper limb. So this is what we are going to do today. Now pectoral girdle, pect means chest. So pectoral girdle is made up of your scapula and your clavicle. So those are the two bones we are going to look at. Then we are going to do, in the upper limb, we are going to do humerus, radius, ulna. I will not be doing hand today. We are going to do that next time, along with the lower limb and the pelvic girdle. So we are going to finish appendicular skeleton in 3 class settings. I just would like for you all to have an extra class for reviewing and revision. So we are not studying new stuff every single day. I just want you to have that downtime that you can review at your own pace. Okay, so scapula. Let's see. In the scapula, we are going to look at spine, acromion process, coracoid, glenoid, cavity, superior border, medial border, lateral border, supraspinous fossa, infraspinous fossa, subscapular fossa, and the acromioclavicular facet. Clavicle is just going to be covering ends, sternal end and the acromial end. Okay, so now let's look at our appendicular skeleton. We did the axial skeleton, the yellow, that makes your axis, right? It makes your axis in the middle, center. We are not going to do that. We are going to look at the appendicular skeleton. So we are going to look at the appendicular skeleton. And as I mentioned earlier, we are going to look at, this is your clavicle. This is clavicle. This is your scapula. We are going to do those two, and they make your pectoral girdle. Girdle is anything that makes a circle. So if you look at it, this is kind of making a circle. Do you see that? Because the bones are connected to each other. So this is your pectoral girdle, which is made up of clavicle and scapula. Then we are going to do humerus. This is the upper arm bone. Then we are going to do radius, which is the forearm. Radius is present behind the thumb. And then you have ulna, which is present behind the pinky. So ulna is always behind the pinky, and radius is always behind the thumb. So we are going to do these bones today: clavicle, scapula, humerus, radius, and ulna. Those are about 5 bones, but they are pretty easy and simpler compared to what you did in for axial skeleton. Again, here is your pectoral girdle. Pectoral girdle is made up of 2 bones, 1 and 2, and a joint. So the bone 1 is clavicle, bone 2 is your scapula, and this joint right here that you are looking at, this joint is called your acromioclavicular joint. So basically these 3 things make up your pectoral girdle. Now we are going to look at the bone, which is your clavicle. In the clavicle, we are doing the 2 ends, sternal and acromial end. Feel the bone and curl your fingers around the clavicle, the 2 ends. One end is going to feel flatter. The other end is going to feel chunkier. So, clavicle, match the shape. What is the shape of the clavicle? Match the shape of the clavicle from your box. And then, once you have the bone, then curl your fingers around the 2 ends and feel which one is flatter and which one is chunkier. The flatter part is your acromial end. That is your flat part. Do you understand? And then the chunkier part, which feels like heavy and chunky, that is your sternal end. What does that mean? Sternal end is going to articulate with the sternum. So, guess what? Your sternum with the rib cage is right at the sternal end, and the acromial end is where your shoulder is going to be. Do you understand? So that is how you are supposed to know the bones. Now, sometimes, not sometimes, in your appendicular skeleton, they are going to ask you left and right. So you will have to identify left and right. Now, when you look at the clavicle, you're going to see it has smooth surface. So this right here, what you are looking at, this is smooth. So smooth is upper surface. If you look underneath, and let me take you to Google. So scapula, inferior surface. Oh, no, not scapula. My apology. Clavicle. Okay, so this is a good bone that you can look at. Hopefully you can see the hand. So the top photograph in this photograph that I am moving, the top photograph that I am moving, in that the upper shot of the bone, that is smoother surface. So this is going to be your superior surface. Now below you have the posterior, and read it, posterior surface. Look at the posterior surface. It has a lot of bone markings on it. It's not smooth. It has got a lot of bone markings on it. So posterior surface, not posterior, inferior surface is uneven. Superior surface, the top one, is smooth. Also, keep in mind acromial and your sternal end. Flatter end is acromial towards the shoulder. And chunkier end is the sternal, which is going to be near the sternum. So now you know which part of the bone is medial, which part is lateral. Now, once you know medial and lateral, and you know superior and inferior, you should be able to figure out what side bone it is. Also, pay attention to the fact that this convex part of the bone, that must be medial and anterior. So convex part has to be medial and anterior. Now, what does that means? Okay, so I have to show you myself so you will have an idea. I'm holding the bone right here. I'm going to curl my hands around both ends, and I'm going to feel. This end feel chunky. I don't know how to make it bigger, but oh well. So this side is the chunky side, which has to be sternal. This is flatter side of the bone. So this is going to be lateral. This is smoother surface. See, this is smoother surface. And underneath, you can see all these markings. This is rough surface, which is inferior. Smoother surface is superior. Notice this. This right here is the convex part. Convex part has to be anterior. So if you have figured out medial and lateral ends, superior smooth and rough inferior surface, and the fact that convexity needs to be anterior and medial and concavity needs to be lateral and anterior, then you should be able to figure out what side bone it is. So this is going to be my right clavicle. Why? Because chunky side is medial. It is going to go with my sternum. Flat end is going to be near my shoulder. Smooth surface on the top. Rough surface at the inferior. And this convexity is medial and anterior. And concavity is anterior but lateral. So this is my left clavicle. This is my left clavicle. Okay, so that is never mind. Okay, the next thing we are going to do is scapula. So let's go to the scapula, and I am going to vanish. Okay, scapula is right here. Okay, just do thumbs up if you understood the first bone. And if you didn't, then just raise your hands who did not. Okay, so now we are going to proceed to the next bone. Okay, the next bone is your scapula, and as you can see in the diagram right here. Now notice there is a spine part, and then you notice there is a smooth part. Smooth part is your anterior part, and the part that has the spine process is your posterior part. Do you understand? Smooth is anterior, spine of scapula is posterior. Is that clear? So now let me show you more. Now the spine of scapula, it enlarges. Notice it enlarges right here. Huh? This enlargement is acromion process. Now, pay attention to where I'm going to show you the acromioclavicular facet. Acromioclavicular facet is right here. Do you understand? Acromioclavicular facet. It is right here. Then you are going to look at another process. You can see it more clearly from the anterior surface, and that is your coracoid process right here. This is your coracoid process. Okay? Coracoid process. Now, what makes your joint cavity? That is going to be this right here. This is your joint cavity. What is this? Glenoid cavity. This is what makes your shoulder joint. Glenoid cavity makes your what? Very good. It is going to make your shoulder joint. Now, understand the word spinous. So what is spine? Let me show you what is spine. This right here is the spine of scapula or scapular spine. Do you understand? The scapular spine expands into acromion process, the yellow part. On the yellow part, you can see the pink area, which is the acromioclavicular facet. And the lilac colored parts are your glenoid cavity that makes your shoulder joint. Fancy name for shoulder joint is glenohumeral joint because it is between glenoid and humerus. Glenohumeral joint. Now that we know the spine of scapula, now we can do supraspinous and infraspinous. So what is supraspinous? Supraspinous means above the spine. So you see this part? Huh? This is above the spine and hence it is called supraspinous fossa. Above the spine. Then you are going to see infraspinous fossa. Infra means below. So this is infraspinous fossa, which is below the spine. Do you understand? Infraspinous fossa. Infra, below, spinous, below the spine. The next is your, now we have to go on the anterior surface because I am going to show you subscapular fossa. Subscapular fossa is on the other side where there is no spine. Where is that? Well, that is going to be right here. So this is your subscapular fossa. See that? Subscapular fossa? Huh? Now we are going to look for the borders. So what are the borders? Let me show you now. This border is called lateral border. Why? Because this is where your arm is going to be attached, and this is close to your axilla. Do you understand? So remember your arm is on this side. Huh? Hence it is lateral because your spine is on this side. Do you understand? If this is the spine, so this is going to be medial. If that is the hand, then this is going to be lateral. Do you understand? I'm going to remove this because it is looking ugly. Okay, so this right here is your lateral border. This right here is your medial border. So you have lateral border, you have medial border, and now we are going to look at the superior border. Understood? Huh? Everyone? So let's go back to our handout just to make sure that we covered everything. We did spine, acromion process, coracoid, glenoid, superior, medial, lateral border, spinous processes. supraspinous fossa, infraspinous, subscapular fossa. We did the acromioclavicular joint. We did it all. Okay. Now, I am going to show you again myself. Okay, so this right here is scapula. In the scapula, you see this spine? When you have a spine, this is the posterior surface. So this is your posterior surface because of the spine. This is your anterior surface, no spine. This is spine. This is acromion process. This little thingy right here is your coracoid. This is your coracoid process. This is your glenoid cavity where your humerus is going to articulate and is going to make a shoulder joint. Lateral border, medial border, superior border. This is subscapular fossa. This is spine. Above the spine is supraspinous fossa. This is infraspinous fossa. And we did all of that. So I'm going to vanish now. So those were the two bones. Now, is that bone clear? Thumbs up if it is. Thumbs down if it is not. Any thumb down? Excellent. Okay, so now we are going to go to the next bone, which is humerus. So let me go to the humerus. Now I'm doing humerus first because look at humerus. It has a lot of stuff. Radius and ulna does not have much. So let's finish the difficult ones. Easy ones are easy. In the humerus, we are going to look at head, surgical neck, anatomical neck, greater tubercle, lesser tubercle, intertubercular groove, deltoid tuberosity, nutrient foramen. It is mostly on the shafts, but they can be found anywhere. Then you have medial epicondyle. It is the one which sticks out and is the bigger one. Then lateral epicondyle, capitulum, trochlear, olecranon fossa. And then there is the coronoid fossa. So we are going to look at all those. Now let's go back to the PowerPoint. Now humerus. Humerus is the bone of upper arm. Upper arm is also called brachium. Brachium is your upper arm and humerus makes your upper arm. One end of humerus makes the elbow, the other end of the humerus, which is the top end, makes your axilla, right? So axilla at one end, elbow at the other. In between that, those landmarks is your humerus. Now we are going to look at parts of this bone right here, right? This is your little humerus. Here is the humerus. Now, head is always rounded. So you can see the head right here. This is the head. Head sits on the neck. So this is one neck, and this is called the anatomical neck. The other neck is this neck right here, which is called the surgical neck. Do you understand? So there is anatomical neck, and then there is surgical neck. Now, deltoid tuberosity is this part which is sticking out. So in the upper 1/3 of the bone, you can see it sticks out. This sticking out part is deltoid tuberosity. This is where your deltoid muscle comes and attaches to the deltoid tuberosity. Then you have greater tubercle and lesser tubercle. This is big one. This is your greater tubercle. This is the little tiny one. Look at it. This is the tiny one. This is your lesser tubercle. And the other one is the greater tubercle because it's bigger. So this is like really big. This is your greater tubercle. In between the two, you see in between the two, this area. This is intertubercular groove. This is in between the two is your intertubercular groove. And you can see the deltoid tuberosity right here. You see this part in the around the mid part of the humerus, you are going to see the deltoid tuberosity. Now, foramen, they can be present anywhere, nutrient foramen. So they are showing nutrient foramen right here, but it can be present anywhere. Do you understand? Nutrient foramen allows nutrient artery to pass through it and supply the bone, basically. Now, let's look at the lower end of the bone. So we just did the proximal end. Now we are going to do the distal end of the bone. At the distal end, notice this part which is sticking out compared to the other one. This is your medial epicondyle. Medial epicondyle sticks out, and this is referred to as the funny bone. If you hit anything on this bone, it's going to give you weird kind of tingling sensation. This is your medial epicondyle. It is present medially. This right here. It sticks out more. The other one is your lateral epicondyle. It sticks out less. So this is your Okay, so this is your lateral epicondyle. Notice lateral epicondyle does not stick out too far away. Do you notice that? It does not stick out that far away compared to the medial epicondyle. Now, notice two things. There is this rounded area right here. This rounded area is called capitulum. Capit means head, and it is rounded like a head. Do you understand? Capitulum is this rounded area. Next to the rounded area, you are going to see you are going to see this part. So this part right here is your trochlea. See, this part is trochlea. And you can see it more clearly on this side. This entire thing is trochlea. Now you need to know anterior from posterior. How would you know anterior from posterior? Because lateral and medial is pretty easy. Lateral is going to be the head. Head is going to be medial. Tubercles will be lateral. Do you understand? Because head is medial because it's going to make the joint. Which means if head is medial, scapula is going to be somewhere here, and your spine is going to be somewhere here. So that's why head is medial. The other side is lateral. Okay, so we have figured out medial and lateral. How about anterior and posterior? Anterior is the side which has this deep depression. You see this deep depression? When you see a deep depression, that is your posterior side of the bone and is the olecranon fossa. Anterior side is going to have the shallow depression, which is your coronoid fossa. It is shallow, smaller, and it is present on top of the trochlea. So this is trochlea. It is present on top of the trochlea right here. And that is your coronoid fossa. So coronoid fossa is present on the anterior surface, the shallow depression, and olecranon fossa is present on the posterior surface, which is the deeper fossa. Now, if you know medial, lateral, anterior, posterior, you should be able to figure out what side bone it is. Now, let's go back and check if we covered everything for humerus. Head, surgical neck, anatomical neck, greater tubercle, lesser tubercle, intertubercular groove, this. a nutrient, foramen, medial, lateral, epicondyle, capitulum, trochlea, olecranon fossa, and coronoid fossa. Yes, we covered everything. So now, let me show you okay, so this right here is your humerus. This is the proximal end of this bone. See the rounded part? This is the head. Head is medial. This is lateral. In the lateral part, notice you see this big area. This is your greater tubercle. And you see this little knob right here. This is lesser tubercle. This is lesser tubercle. This is greater tubercle. And in between the two, you see this part which is present in between the two. This is your intertubercular groove. You see this outline on the head? This is your anatomical neck. Surgical neck is right here that you can curl your finger around. This is surgical neck. This is the shaft. Notice the bone sticks out in the midline. Where it sticks out laterally, see, head is medial. So laterally where it sticks out, that is going to be deltoid tuberosity. And now we are on the distal end. On the distal end, see this rounded part? That rounded part is your lateral part, and that is capitulum. Capitulum. And this part, which is the medial part, is your trochlea. Next to the trochlea is your medial epicondyle. It sticks out. This is your funny bone. You can also see it in your arm medially. If you look, this side medially is where it sticks out. And if you hit it, it gives you a very funny feeling. And this is your medial epicondyle. This is lateral epicondyle. On top of the trochlea, you see this little depression right here. This is your coronoid fossa. Coronoid fossa is present anteriorly. This is the posterior side because you can see the deep single fossa, big fossa. This is your olecranon fossa. This is trochlea. This is medial epicondyle. This is lateral epicondyle. Now, if you align the bone with the head medial and coronoid process facing forwards, medial epicondyle is medial, then you can see that this is my left humerus. And that is how you can figure it out. Now I am going to vanish. That was humerus. Thumbs up if you understood. Thumbs down if you did not. Okay, very good. Now let's go to the radius first. Okay, radius. I need a radius. Okay, now let's look at our handout one more time to figure out what is radius going to be about. So in the radius, you can see again head, neck, radial tuberosity, styloid process, scaphoid and lunate facet, and then there is the ulnar notch. Okay, easy peasy. Let's go to our now radius is the bone which is behind the thumb. So that means in this skeleton, this is your thumb. This is your thumb. So radius is going to be this bone. This is your pinky. So ulna is going to be this bone. Ulna, radius. Understood? Now let's look at the bone. Why radius is called radius? Radius is going to have a rounded head on the top. You see this? It's rounded. And radius you can only measure in a circle. So let me show you a radius. Radius, top. Do you see right here where I am moving the photograph? Do you see the top circle? That is basically the bird's eye view of radius. See this bone that I am moving on the top? This is radius, and you can see right here the up top, right? That is your radius. You see the top of the bone right here where I'm moving the photograph? That says head of the radius right here. This is what I showed you, completely round circle. And radius is measured on a circle, hence it is called radius. So coming back to my PowerPoint, do you see this part right here? This is your radius, and this is the head. Right below the head is going to be the neck. So this part right here is the neck, because head always sits on the neck. Underneath it, do you see this rough part which is sticking out, really sticking out? This is your radial tuberosity. At the other end, so we are done with the proximal end. At the distal end, see this part sticking out? This is called the styloid process. It's present laterally. Now we are going to look at the undersurface. What is the undersurface? We are going to look at this undersurface of the radius. And remember, this is the styloid process. So we are looking at the undersurface. So when we go and look at the undersurface, remember this is the styloid process. Huh? This is the undersurface. So the undersurface has two facets. The one which is right next to the styloid process, this triangular facet, this is called scaphoid. This is wrong. This is called scaphoid fossa. And this one right here is lunate. And you can call it fossa or facet. Lunate fossa or scaphoid fossa. So the triangular one right next to the styloid process is your scaphoid fossa. And the one which is rectangular and is away from the styloid process, that is your lunate fossa. Now, you see this part, the dented part, the concavity. This is called your ulna facet. Now let me see what your ulnar notch, sorry, that is called ulnar notch. So this right here is your ulnar notch. Over here, this part right here is the ulnar notch where ulna is articulating. Do you see that? Now let me show you on the okay, this is your radius. Look at it. It's completely circular. And that is why it is called radius. So this is the head. It sits on the neck. This is the neck. And you see this part sticking out. This is radial tuberosity. This is the proximal end of the radius. And it is your lateral bone, which is right behind your thumb. So this bone is your radius. This is pinky. So right behind pinky is ulna. This is the distal end. Distal end, this right here is your styloid process. Styloid process is at one end and ulnar notch is at the other end. See this concavity right here? This is ulnar notch because this is where ulna is going to come and articulate with the radius right here in the ulnar notch. Now don't get confused. This is called ulnar notch on the radius bone. This is called ulnar notch, but this is the radius bone. Now flip it and look underneath. This is the styloid process, remember? So the facet underneath the styloid process, this triangular facet, that is facet for scaphoid. So this right here is scaphoid, the lateral one, and the medial one is your lunate facet. Styloid process is lateral, and this is what you feel, the bone sticking out right behind your thumb. So this is your thumb. Here is your styloid process of radius. And we only have time for this much today. So I am going to continue with the ulna and the hand and the other bones next class time. So hope this was helpful. I am going to stop right now. And that's all.